Welcome, Governor. It's good to have you back, and we're excited to hear what you have to say. You're recognized. Okay, do you have a button there?
I do have a button.
There you go, all right.
Should I push the button? Senator Hendren, Representative Collins, thank you for your leadership. Members of the task force, thank you for your arduous labors in this common endeavor that we've engaged in. I also want to recognize the members of the Medicaid Advisory Council that I've assembled, and thank you for your guidance and your participation today. As you know, I have 4 children, 5 grandchildren, and I've got 3 sons. One of my sons, when he was in junior high school, he was going to a little bit of a rough school, and he had a tendency to get into a few fights. And so one day he came home after junior high school day and after an episode of fighting, and I said, "Son, what happened?" And he said, "Dad, there were 2 guys fighting and I went in to break it up. I got punched and I forgot what I went in there for and I started fighting." And I tell that story because when it comes to Medicaid reform, sometimes it's easy to lose our focus as to what we're trying to accomplish. And this task force has done a great job in terms of keeping our focus, keeping the eye on the ball, looking for solutions, and bringing people together, and I compliment you for that. I also want to express appreciation to the John Stephen Group, who's communicated regularly with us, who is going to make a report later on, and I appreciate his participation in this important task. This morning, I know my main function is here to report on my meeting with Secretary Burwell, which I will do and I will get to. But I did want to give a little bit of background. I want to talk about the Secretary Burwell meeting. I want to talk about the current status of Arkansas Works, and then the practical considerations as we look to the future. As you know, I have appeared before you on 2 previous occasions, and I have indicated my support for Arkansas continuing to receive the federal Medicaid expansion dollars. I did this on 2 conditions. One, that we could reform the program. Private option ends, where do we go? We want to add reforms, additional waivers that we would request for more work opportunities and training, personal responsibility, and program integrity. We also needed to generate savings for the Medicaid budget as a whole, and I identified savings of $835 million over 5 years. And the reason is that we, first of all, understand that Medicaid can be managed better with the same quality of service and emphasis on that, but we have a responsibility, the taxpayers, to manage the program well, and we have an opportunity to create savings. And a side benefit is, and one of the major goals is, that we would not have a drain on general revenues because we have expanded Medicaid. And so my plan that I have presented is called Arkansas Works, and it accomplishes the objectives that I'm speaking of. It accomplishes the objective of reform. It accomplishes the objective of trying to move federal policy toward more flexibility for the states. That is my objective. It provides the state flexibility. It gives improved management of our Medicaid programs. It gives health care coverage for those of the expanded population, and it combines with work opportunities and responsibilities. And so it's a good start. It is a good place to be right now under current federal policy. We're not there yet completely in terms of flexibility for the states, but Arkansas Works is a good start and movement in that direction. It is my hope that next year the federal government will once again reform health care by expanding on the state flexibility we're already advocating for and seeking these waivers. It is my hope that they will move into a true block grant type program for the states, where there's maximum flexibility, where we can manage the entire Medicaid budget to create the savings, flexibility, the work incentives, the program integrity, and the personal responsibility. And so if you look back a little bit further in our history, where we are right now, I did not create. I did not create the situation that Arkansas is in at the present time. I inherited it. That's not a criticism, it is a statement of history. And when I took office, Medicare funds had already been drained from the state of Arkansas as part of the Affordable Care Act. They took Medicare funds, reduced that coverage, and that hurt our hospitals, our health care providers. The second thing that happened, because we responded to it in Arkansas by moving to the private option, our infrastructure for providing health care for those who had no insurance was dismantled. Arkansas health networks no longer exist. We cannot retrace those steps in a short term. And to a certain extent, employer-based insurance that we historically relied upon in our country has declined. And it's because people have moved to other options, whether it is private insurance or whether it is the Medicaid expansion, employer insurance has declined. And then you see the financial cuts at UAMS, our prisons, and other programs, and all of these cuts before I arrived on the scene were baked into our budget. And the savings from the elimination of programs and the transfer to Medicaid expansion that saved us taxpayers' dollars, and from an Arkansas standpoint, all of these changes had been absorbed into our budget computations. And so that's a reality of life that I inherited. Another reality of life is what I reflected in my speech to UAMS, what was it, last January? In which I said that whatever we do in the future should not leave the 200 or 250,000 that's on the Medicaid expansion without a recourse for health care access. And so you combine all of those factors together, the reality that I inherited, the baked-in budget, the cuts that already had been done, that had been drained out of Arkansas, the need for the care and the reliance upon the care, we came to a very practical and Arkansas-oriented solution, and that is replace the private option, continue with the federal funds, and reform the program and look for a different day down the road when they change federal policy. And so that is the plan. I call it Arkansas Works. And that brings me to the meeting that we had with Secretary Burwell. First, I want to thank Senate Pro Tem Jonathan Dismang and Speaker Jeremy Gillum for their participation in that meeting. The Surgeon General was there with me as well, Dr. Greg Bledsoe. And as we had the meeting with Secretary Burwell, we raised a number of issues, and this is totally a side note, not a part of my presentation today on Arkansas Works, but we did raise the issue of the $7 million that we had to recoup from the insurance carriers because of retro termination. And the carriers then were trying to recover that money from the healthcare providers, and some of you might have heard from these folks. And so yesterday, John Seelig, who's here, director, announced that based upon our meeting in Washington, D.C., Secretary Burwell did agree to federal funds to cover that $7 million so that it does not have to be recovered from the providers. And so that was the success of the meeting. And then, while that was a benefit, there were obviously some fundamental differences in thinking between myself, my colleagues who were there, and Secretary Burwell and this administration. I see the Medicaid expanded coverage as a means for individuals to have assistance in health care coverage as they move up the economic ladder. I see it as a temporary assistance to an end goal of employer-based insurance, of work, of training. This administration sees it differently. Rather than temporary assistance to an end goal, this administration sees the Medicaid expansion as a permanent program. And that's a fundamental difference between us. And so I see the coverage as more of a means to work opportunities that are conditioned upon certain behaviors that we desire, such as work, social responsibility, and healthy living, the Healthy Arkansas Initiative. This administration sees that health care coverage without as many specific conditions. I see it as a means of moving up the economic ladder. This administration sees it as a permanent status. And so we butted heads. We had a difference of opinion. But at the same time, she has some roots in West Virginia and Arkansas. She's a very practical lady, very cordial lady. And we both realized the differences of opinion and the limitations on each of our positions. And so we presented our Arkansas Works, the framework for that. We got her response, and we got a formal letter yesterday that I wanted to present to you, that I believe is positive and recognizes that both sides are trying, under the current federal policy, to reach a conclusion that will help us to move forward with the framework of Arkansas Works. And members of the task force, you have the letter in front of you, and I wanted to make a reference to a couple parts of the letter from Secretary Burwell. The first paragraph is the nice parts. The second paragraph. I appreciate your renewed efforts to make the Arkansas Medicaid program more cost-effective, focusing on value and quality consistent with HHS goals. As noted, while Arkansas has made progress, there are still many opportunities for significant savings and improvement in care. In our meeting, we discussed the potential substantial reforms you are proposing to significantly alter Arkansas's program. In particular, we discussed the four major goals you have identified for your redesign efforts in Arkansas Works: incentivizing work, increasing personal responsibility, increasing program integrity, and supporting employer-based insurance coverage. And let me just pause for a second. She talked about substantial reform efforts. And I know there are some that say this is just simply cosmetic changes. There's a reason you have to ask for a waiver, and that is because it's a change from existing law and requirements. And so she refers to these as substantial reforms. I accept her judgment on that. These are substantial reforms that we're proposing. The next paragraph, you outline a number of specific changes in support of these goals, and many are quite innovative. In some cases, they also push the bounds of what is allowable under federal Medicaid law and raise concerns about potential adverse impacts on the beneficiaries. However, I am hopeful that we can work together to find acceptable approaches to reforms in each of your focus areas. The details will be important. We're committed to work with you and your staff to come up with the right approach. I paraphrased the last sentence. The next one specifically addresses the incentivizing work. With respect to your interest in incentivizing work, we agree with you that increasing employment in the state is an important state and federal objective. We'd like to work with you to identify potential solutions to support this goal, consistent with Medicaid's role as a health coverage program. And so she goes on and indicates her support for job training and employment opportunities for Arkansas Works participants, strengthening the connection to workforce, and helping people climb up the economic ladder. I'll end with that. They look forward to receiving the formal proposal as we continue to develop and work with CMS on the details of the plan. And so the conclusion of that letter, in my judgment, is that the Secretary, HHS, accepts the framework of Arkansas Works and gives us the opportunity to work on the details. I consider that very positive development and allows us the opportunity to continue and to draft the legislation necessary to accomplish Arkansas Works. Now, let me go into just a little bit more of the framework on Arkansas Works. You have the latest outline in front of you. There's actually more details that have been hammered out as to the practicalities as to how this would work. I'm not going to go into those details this morning, and you'll probably thank me for that. But I do invite the legislators who would like to have more detailed briefings that we'll make our DHS officials and Medicaid director available, as well as John Martin with my office, to go through the practical working elements of Arkansas Works, and also to get your feedback as we continue to develop the specifics of the legislation and the discussions with CMS. But let me review those quickly with you. First of all, the employer-based insurance, in my judgment, becomes more and more important as we see perhaps a decline in employer-based offering of health care insurance for their workers. And so whenever we do have employer-based insurance, the Medicaid expansion population would be mandated to take the employer-based insurance with the wraparound coverage to equalize it with Medicaid expansion and what others would receive. And this would be not we're trying to make it so it's workable for the employers. They would have to present the case saying, I want to be able to participate in the state's program so that we can show that we're meeting the criteria for insurance. We have employees that qualify or they're on Medicaid expansion. I want to transfer them over to the employer-based insurance and work out the details of that initiated by the employer. And then we also want to provide an incentive to the employer. And the employer, because we're taking them off of the Medicaid expansion population and add them to the employer-based insurance, it saves the state's money. The MNAC group estimated to be about $29 million. We want to take and negotiate with CMS to take a portion of that $29 million in savings and utilize that as incentives for the employers to participate and to help them as they provide coverage. That is a good, great, an incentive, a benefit, a special opportunity to enhance the policy of employer-based insurance. And I think that's a very important part of it. We've got to continue to negotiate with CMS to accomplish the use of the federal dollars and the federal savings dollars for that incentive purpose. We'll continue to work on that. The second part of it, incentivizing work opportunities. Senator Elliott, I liked your language suggestion. Because this is not, when I talk about work incentives, I don't want to suggest that people don't want to work out there. They want work opportunities. And so what we're trying to encourage and develop are work opportunities for those that might be on the expanded Medicaid population. And that would be requirements for referral to worker training. It would be trying to look at incentives from the Department of Workforce Services side to encourage that worker training and that employment. And I was delighted with my meeting with Secretary Burwell that she said, you're looking at this too narrowly. That I'm looking at this as simply what we can do within the Medicaid program. She says, look beyond that to the Department of Labor, to the Department of Workforce Services as a state agency, and see what incentives they can offer to attract and pull these people into the worker training and to employment. And so I'm looking forward to a call with the Secretary of Labor trying to identify specific programs that we can enhance that worker training and that worker ability to get a job and to provide for the family and to move up the economic ladder of success. And so Secretary Burwell in a letter committed to working with the U.S. Department of Labor to identify additional incentives for individuals who are referred to the Department of Workforce Services by DHS. Third element is personal responsibilities. And this is simply saying those individuals with incomes above 100% of the federal poverty level will be subject to copays, will be subject to premiums of perhaps $19 a month. It was 2% of their income at the federal poverty level. This is consistent with what they'd be required if they went on the exchange. And this would be a state debt. If they fail to pay that, that would be subject to collection. We're also looking at additional incentives to enhance that payment and to make sure that they are exercising personal responsibility when it comes to a healthy, active Arkansas lifestyle. The fourth part of Arkansas Works is program integrity, eliminating the 90-day retroactive eligibility. This will transition Medicaid to a more typical type of insurance arrangement where coverage starts when someone is enrolled in the program. That makes sense. It equalizes what's in the private market. And then fourthly, an expeditious time frame for terminating the waiver with 30 days notice, and that is something that we discussed with Secretary Burwell as well. And so that's the framework of Arkansas Works. You've heard most of it. There was a few little new twists in there that I think strengthens the program. We'll continue to keep you posted on that. The next thing I wanted to talk about and mention is the savings. John Stephen Group is going to make a presentation after I leave, and so they're going to talk about the savings and means to achieve the savings that we need in the overall Medicaid budget. And my goal is to accomplish those savings. But if we can maximize those savings, I believe that is a means in which we can reduce the number on the developmentally disabled waiting list. As you know, we have approximately 2,900 on the waiting list. There have been 125 on that waiting list since 2007. The current average cost is $52,000 per individual, with a total projected cost of $6.5 million annually if you moved simply the 125 off the waiting list that have been waiting there since 2007. The state portion of that, 30%, is $1.9 million. I challenge you to work with me to create sufficient savings to reduce that waiting list and apply certain savings in this effort to reducing that waiting list that has been there far too long. We can do that together. And the savings that is being presented by the John Stephen Group, which they obviously will cover, but I had asked for $835 million over 5 years. But it's been pointed out that the savings that are available are really greater than that. And so if we can increase the savings, work together to apply that to reducing that waiting list, then we've accomplished a great deal. And one comment about the debate on managed care versus other means of accomplishing the savings. As you know, the last time I made my presentation here, I talked about the managed care in reference to the behavioral health and the DDS population, excluding the human development centers. And if you have options of whether to try to create savings without managed care, with managed care, I just want to note that if you do it without managed care, you are relying upon the Department of Human Services, with its management, with its IT functions, to change the systems, to create more contracts, to have more employees to oversee this versus relying upon a private sector solution. And so I know that will be discussed, but I wanted to say keep looking for those savings. Keep looking for those savings, because if we increase those savings, then a good place to apply those is the reduction of the developmentally disabled waiting list. And now, let me conclude by talking about what is the right course for Arkansas. What I have outlined, I believe, is the right course for Arkansas, and I'll give you a couple reasons, and you'll get tired of hearing these reasons. First of all, it's simple fairness. Right now, we have federal, state, taxpayers' dollars, federal dollars, subsidizing those in the middle income category and their insurance on the exchange. If we eliminate the federal dollars in the Medicaid expansion population, then we are saying no in terms of helping those in the lower income category, but we're going to maintain our assistance to the middle income categories. That to me is fundamentally unfair and a bad policy choice for us in this state. Secondly, it's about health care coverage. At the present time, under the current federal policy, this is the best option for providing some level of health care coverage for those 200,000, 250,000 that are on the Medicaid expansion. And then there are the budget practicalities. This is not the exclusive reason. Some say a 6% across-the-board cut in the state budget's okay. Some say we don't need a highway program. Some say there ought to be plenty of money in the state budget to create these kind of savings. But we need to understand the consequences to the state budget. And there will be a $100 million plus deficit in a balanced budget if we do not have the utilization of the federal Medicaid expansion dollars that was baked into our budget before I became governor. And so we would have to look at ending the highway program unless you raise taxes. We would have to cut back on our health care services. We would have to cut back on public safety. We would have to cut back in terms of education. It would hit us across the board. And we'd be delighted to talk more in detail in briefings about that budget. And finally, it's a matter of timing. As I pointed out, I have to be a practical governor. I have to deal with federal policy today, not tomorrow, but today. And today, the decision that we make is the right one for Arkansas under current federal policy. Next year, there might be a different federal policy. Let's examine what we need to change next year if there is different federal policy. And whether it's a Republican or Democrat administration, they have to deal with the reality that there's 30-plus states that have accepted federal Medicaid expansion dollars. And it's not going to be a cliff. It's going to be a transition, and I would expect in the conservative approach that expansion will be what we're pushing for now, which is flexibility, maximum flexibility for the state in a block grant type program where we can manage it, create the savings, and put the values in place that we desire. And I hope that's the end of the federal policy. It may or may not happen. Elections make a difference, but that's my view. Federal policy right now is fixed in Washington, D.C. Let's make the best decision now for Arkansas. As federal policy changes, we will adjust accordingly. As powerful and determined as we are, we cannot change federal health care policy by simply being stubborn. Let's make the right decision for Arkansas, and let's keep our focus. Thank you very much.
Thank you, Governor. We're going to take a 10-minute recess. Members will stand in recess for 10 minutes. Thank you, Governor.